We're just going to give it a few more minutes for a couple more panelists to join us, and then we'll begin. And thank you for all of you that are adding your names and organizations into the chat. It's great to see the range of perspectives that we have today. Okay, Laura, shall we go ahead and get started?
Yes, please.
Okay, well, welcome everyone. We're really pleased to have you all here with us today. On Monday, Laura, our amazing facilitator for this project, led multiple group meetings to gather feedback on very specific areas. Our meeting today will be Laura sharing out those findings and recommendations and gathering additional feedback from all of you. And I got a preview of the meeting right before this one, and I'm just so excited about the work that is coming out of this group. It is just phenomenal in such a short amount of time, the recommendations that are coming forward. And as we shared in our first meeting, the format for this task force is that we will implement rolling recommendations. And as Laura will share, there are a number of recommendations that we are going to be able to start digging into right away. So I can't tell you how grateful I am for your time and your dedication and your thoughtfulness throughout this process. So with that, I will hand it over to you, Laura.
Great, thank you, everybody. Just a reminder, this is a public meeting and it's being recorded, as all of our meetings are. I want to echo what Mary Alice said about your amazing participation in all of our meetings on Monday. It was a long day. It was almost 12 hours of straight Zooming, and many of you were in all or a lot of the meetings. And I can't say enough about how impressed I am with your collective professionalism and dedication to these issues, and your willingness to give of your time. It's pretty amazing. So we had 6 meetings as a reminder. So what I'm going to do for each meeting is I will provide sort of a summary of what it is we talked about, and then I will invite folks who participated in that particular meeting to correct me or provide any additional color or information about what we talked about. And then I'll open it up to everyone else in case there are folks who were unable to participate in the meeting if they want to add something. And we should have about between 12 and 15 minutes for each meeting, which is a lot to condense. But let's do that. And because I'm looking at notes and I only have one screen today, I'm going to rely on Mary Alice and Lindley to watch the chat. So if I'm a little slow in getting back to you on that, please forgive me in advance. All right, so the first group we had was 90 minutes. That was the longest. And what we talked about there was education. So the talking points for this group were: how do we convey information and raise awareness or fill information gaps about safe childcare with families? How do we raise awareness among the childcare provider community and, again, fill in information gaps regarding current regulatory requirements, including sharing information both on how to become licensed and how to be an exempt provider? And we tried to spend some time strategizing on a communications plan that would distribute this information to stakeholders. And then we considered briefly additional information that could be in standard operating procedures. There was a separate group specifically for that, so that was just sort of in the back of our minds. So as it relates to the content of the messaging, the overall themes were exemption laws, that folks wanted to see additional and clear information about the scope of the exemptions, so that folks who are exempt understand why, and so that folks who might suspect they're exempt but not know for sure would be able to clarify that, and just in general, and for parents to understand what an exemption is. We discussed additional information on red flags that we could use for stakeholders who are coming through the environment or parents, such as the number of children in care, red flags to indicate that care might not be safe. So that would be number of children in care, and then why licensed versus unlicensed versus exempt. You know, FFN care is important, what sort of the roles filled by each of those options, why they're important, and what those distinctions mean. We decided that we thought that it was important to present the information and to include information designed to specifically help folks who are underserved, people of color, folks who are hesitant to involve themselves with the government. I think that's an area where we can try and flesh out a bit more as we look at specific language and information, you know, as we put it out there. Some folks thought it was very important to make sure that people know that you need a new license if you move. So that a license is specific to an individual as well as a location. In almost every one of the groups, people mentioned that the exemption is 4 children per location or house and not 4 children per adult, so that you couldn't have 8 children and 2 adults and still consider yourself exempt. There was some strong opinions that are very well taken about making sure that language is neutral as to have no judgment as to what kind of care a family picks or needs. So the fact that a family needs or chooses to have FFN care is a perfectly excellent choice. And there's no judgment about the decision to make that choice. We tried to brainstorm ways that we could be sensitive to our use of the word education as a term, to try and be sure that we weren't using that term in a way that could make some folks feel like they're being judged for what they do know or don't know, or implying that somehow it's their fault or they missed out and didn't do something they should have done and therefore are uneducated. There was consistent reminders to be as simple as possible with this information, continued reminders that the word illegal is inflammatory and not as precise as maybe we need it to be. And then there was concern about the phrase licensed care is the best care on the CDHS website. So we talked about whether we wanted to look at some existing resources and how we might update them based on our work here. And we talked about ways to communicate content, including locations. Folks said that they thought it would be useful to have a digital media so that you could email a PDF and that way folks could print off as many copies as they wanted. We want to make sure that the content and design is appropriate for areas outside of the larger metro areas. So the request was to involve folks, you know, for example, in other early childhood councils outside of the Denver and, you know, larger metro areas early and often, so that we're creating a resource that's relevant for all areas in Colorado and not just some. There's a reminder to use other social media platforms like TikTok, which I don't understand, but my kids do, Instagram, Facebook, Craigslist. There was a suggestion about maybe doing some spots on YouTube if the funding is available. It's the second most often searched search engine, so that could be a good resource for us. Nextdoor, HOA blogs to try and get to those stakeholders and influential folks, influencers who are neighbors. So if you go through an HOA blog, early childhood councils, make sure that we're creating a resource that is in multiple languages for folks who don't speak English or for whom English is not a first language. Make sure it's readable on a smartphone to make sure we're getting those folks who don't have access to computers and internet and rely on smartphones to get that kind of electronic data. There was a push for sort of an initial information drop, yes, but then a follow-up kinds of training and talking points, elevator speeches, things like that, designed to modify behavior. So sort of the initial information and then also following through and making sure it was kind of sinking in. So conversation guides similar to what is currently developed for safe storage or substance abuse, and then maybe even some of the TV or news spots for folks for whom that's still a good resource. Then lastly, we addressed potential partners for communication, recognizing that folks oftentimes get their information from word of mouth, and that could include pediatricians, birthing classes, WIC, doulas, midwives, birthing centers, a circle of parents, OBGYNs for that 2-year checkup, hospitals, libraries, mom blogs, parent blogs, dad blogs, trying to get folks from all the different areas to normalize the conversation and make sure we're including all kinds of parents, not just, mommy groups, and then Facebook. So that was sort of my summary of what we talked about in that group. What am I missing? Other folks who attended that session, what can you add to that discussion and sort of remind me and contribute from others?
Lindley, are those that are not on the panel, our participants, are they able to add, or just in the chat? I'm just wondering about that process.
They can absolutely speak. Just all they'll have to do is just give me a quick note in the chat to say, hey, I would like to come off mute and speak, and I can allow them to do that.
Good gallery view. So what we were focusing on in this one was, again, what information was not out there and how we could get it to folks and how we could convey it in a way that people could hear. So with those 3 prompts, is there anything else that you all want to share, either for those of you who participated in the meeting, if I missed a point that you made, or for those of you who didn't participate, what did we not address that you would like us to focus on?
Hey, Laura, this is Bill.
Hi, Bill.
Apologies, I wasn't at the meeting Monday, but I think that's a tremendous starting point, or ending point potentially. I think I'd be curious if there was any dialogue about the substance of the messages. So certainly you flagged the importance of people understanding the distinction between licensed, exempt, and unlicensed care. I'm also, I'm just wondering too, some of the messages being developed around whether it be safe sleep practices or some of these leading causes of harm to children in childcare settings. I just think the message segmentation by both who's the audience and what are you trying to have them understand would be key. And was curious if there was any dialogue about that. And then the other reflection is I just love the brainstorm around the prenatal period or the perinatal period in particular, and the role of some of our healthcare partners in that, because I know that many pediatricians and OBGYNs, when they're doing various screenings or are engaged in dialogue with patients or expecting families, are oftentimes asking those families, what's your plan for childcare? Are you planning to return to work? And in some ways, it's helping normalize that conversation and just making sure that without further loading what are very packed prenatal and well child visits, I think that simple information readily available around some of these distinctions and what to look for, just an endorsement of that strategy.
Thank you, Bill. We had conversations about the content, but honestly, it was limited mostly to, categories of licensure and number of children and exemption. So I like the idea of maybe tying into those resources links to other material, on safe sleep. And I know I was speaking to someone about safe environments as well. We could certainly use that as an entree into making sure we're covering that content as well. And to answer one question in the chat, yes, we did include libraries, and I think that's a great thing. Then to go back to your other point, Bill, about prenatal and perinatal, hospitals and OBGYNs and midwives and pediatricians did come up in many different groups. In fact, perhaps all of them. And that was one resource where we thought they might benefit from a digital, a PDF they could print out kind of resource, because they probably, they're, potentially could have the funds to make those copies and to hand them out. And the idea was at the 2-month visit with the OBGYN or midwife to sort of just even broach the idea of, if you're going to get on a list somewhere, you should probably start thinking, to begin that conversation, about helping folks understand if they're looking for licensed care, this is the process. If they're looking for FN care, this is what they need to be looking for, and try and really present those options. So I think that's a great idea. It came up later in law enforcement in the fatality review about how we can use those partners in those, it would be more emergencies and emergency rooms and hospitals, to make sure that we're communicating when in the event of a tragedy. So that's a really good point. Does anyone else have comments about the content of information? That was one area where we had less or fewer ideas. All right, any places we missed? What's the TikTok that I forgot? Because heaven knows. Any other categories of sort of important partners that we should include? We didn't mention, for example, Nurse Family Partnership or some of those organizations that are already in the home.
Yes, Laura, I love that. All of our prevention programs, and
Yes.
Joe thinking about how, and Mark, how we can use our access to families throughout the department to spread this information.
Maybe one other setting, Laura. I know it feels maybe late in the game, but our school districts and K-12 partners, parents oftentimes have younger children, they have siblings, or they are, in the networks of folks we all rely on, folks who've been through it and have gotten their kids into the kindergarten door. I do wonder if, these our school district partners increasingly being allies in the work of expanding access to early childhood services.
Yeah.
And while most aren't engaged in the infant toddler space, certainly have relationships and are a trusted communicator in communities.
And Laura, sorry, go ahead, Laura. I just was going to point out, Kendra, the Promoting Safe and Stable Families, all of the parenting classes offered, as well as Kendra has, I think, 12 or 13 different programs within her division that could be a way of getting out to young parents. So I think that covers many of yours. Jennifer Yates that you mentioned. Also, Lisa Sater, the Family Resource Centers are also under Kendra's division. So those would be, they're such a trusted hand throughout our state. So how do we utilize them? Joe, I don't know if you have any ideas on how we can utilize programs under your division to really reach families.
I think I'd feel best about noodling on that a little bit.
Sure.
A lot of the contacts are through the hotline, and information can sometimes be given back out from hotline operators, but it's not typical that anything is mailed, and there's typically not scripts about services. But I think I don't want to say that and not step over an opportunity.
Joe, I just have one thought about this as well, which is because, half of the children in the system are under 5, is part of it direct outreach to your caseworker workforce and providing them with information or resources that they can provide to families when working with them. They may already have access, I don't know, but that's a question mark, right? Like, can we make it easier for them as they're working with families with young children to know how to connect them if it comes up?
Yeah, and I just to quickly respond, with prevention, maltreatment maltreatment prevention workers or say assessment caseworkers, there's a very long list of potential referrals that they sort of have on hand in their brain and their minds, as well as resources that might be more automated, especially in larger counties. So I think that there could be an opportunity to roll that information into some scripts and some databases that they have on hand. The trick is to more, I guess, further disseminate that information and put it, you know, into the systems that they have on hand so that it could be pulled, you know, up when it's necessary, but that it's a part of a larger compendium. And I would look to, yeah, county partners here about maybe brainstorming ways to do that, because it just looks so different county by county at the child welfare division level.
This is great. And I love all the comments in the chat. There's so many additional great resources in the chat as far as teen parent.
Mary, were you about to say something?
These might be too far afield, but I wanted to mention 211, our information system that we have statewide, that they might get phone calls about childcare availability. And I'm also wondering about workforce development centers or others who are helping people find
Great.
employment. As we know, childcare often is a barrier, and many of these individuals who are working in workforce development in other areas don't have these resources.
Fantastic. I love those ideas. See, you guys are so smart. Good work. Good work. All right. So maybe we will go on to the next work group just to make sure we're looking at honoring everyone's work in those groups. So the next one focused a little bit on standard operating procedures. And so the questions here were fairly high level, sort of what does this process of enforcement look like? And so in the standard operating procedure group, we talked about identification, investigation and surveillance, and then enforcement, sort of those three categories. And some of, and we'll talk at the end about sort of some of the recommendations. And so there were some questions about when licensing specialist visits and when are cease and desist letters delivered. So some sort of information seeking questions. I think there's an opportunity to sort of clarify when cease and desist letters will be issued, because some of the stakeholders were concerned that they will for some reason no longer be issued because of new protocols in the Ellie Matthews bill. So we could talk about that for a second.
Sure. Yeah, Laura, I'd love to jump in on that one.
Good.
And so the key here is that when the Office of Early Childhood receives a complaint from a concerned parent or neighbor or community member about potentially unsafe childcare happening, we will respond to that complaint and we'll do surveillance before knocking on the door. And so we'll do the pre-surveillance. If it is determined that illegal or unsafe care is happening, then a cease and desist letter will be issued. If it is determined that unsafe care is not happening after we conduct surveillance, then information on that the team has put together on licensing rules and other information will be offered. In the first scenario that I described, if the team does surveillance, determine that there's unsafe care happening, a cease and desist letter will be issued. They will be posted on our website, and we will pursue the ongoing surveillance and injunction process. So I just wanted folks to know that because I think there was some confusion around that came up in the Monday calls, that we are not, as a result of the Ellie Matthews bill, we're suddenly not going to do cease and desist orders. That's not happening. We will continue to issue cease and desist letters when after surveillance we determine unsafe care is happening. And I'm happy to answer any questions on that. I might need to take some of them back to the team and to our Attorney General's office, but I'm happy to answer any questions that I can on that, just to make sure everybody knows that's our protocol.
All right, thank you, Mary Alice. If there are no additional questions on that, then we'll just keep going through the other topics we discussed. There were some questions about what factors or red flags are considered to identify unsafe care. And this kind of dovetailed with what is the definition of safe care, right? How do we look at this? And we visited a little bit about the resource currently on the OEC website. I think it's in Colorado Shines, but I wouldn't swear to it, that talks about questions to ask when you're looking for care. And we thought it might be interesting to look at that particular resource and make sure that it's updated and inclusive for all of the different types of care. So that was sort of one thing that came up, and we'll talk about that when we go through all the recommendations. Folks suggested that a new department would be more effective than using current licensing specialists or the current, the licensing division to investigate unsafe care. So there would be a separate enforcement division so that folks' attention would not be divided. So that would be their sole job, would be conducting that surveillance and doing that enforcement work. And that might allow, for example, more visits at random times. Folks felt strongly that pickup and drop off were still the best times to observe when children were coming and going and to determine if care was being provided. But additional random time visits they felt would also be helpful. There was a suggestion that Facebook, care.com, Craigslist, HOA websites, Nextdoor, other resources like that would be reviewed, because some of the participants had personal experience with seeing advertisements for unsafe care on those websites. One thing we talked about in this group that was interesting is Mark shared a little bit about sort of his past experience working in I think it was electricians. I also wrote plumbers, that could be right or wrong, where they have a slightly different enforcement model. The way that OEC statute is written, fines are meted out or are given by the administrative law judge. In other departments and other divisions in Colorado, sometimes the division itself is authorized to issue fines, and then folks have an appeal process for that, but it could make those fines more immediate. Or I guess the question is, could that make those fines more immediate? And so one thing the group was hoping is that OEC and potentially the AG or whomever needs to could take a look on what other systems are being used within Colorado that might be appropriate to sort of update what CDHS is doing. Then there was a question about where people could send like screenshots that show that folks are offering care. They're wondering if we could create some sort of database of details that maybe would fall short of something that would trigger an investigation because there's no address, but we could create a database of some of that information so that way, ultimately, when an address was found, we would have access back to those previous, screenshots and things that might be able to demonstrate that care was being offered. There was a question about whether we have a process for an opportunity to address folks who are not licensed, but say they are, so folks who are lying. They asked about how standard operating procedures handle the situation where a report's made to a different department, perhaps CCAP or DHS or some other department learns of unsafe care or a concern about unsafe care. They're wondering how state agencies communicate with each other. Someone suggested that perhaps we consider a communication plan that's similar to like what Tri-County is doing about vaccines to make vaccines less taboo and dispel myths. Could we do something similar for some of the issues surrounding safe care? There's a general question about how can we incentivize safe care, sort of looking at the carrot and the stick. And someone asked, if cars, if you have too many tickets before they're towed, there's a sticker on the front door and it's hard to get off. So can we put something like that, like a sticker on the front door of a house, or a sign in the yard, or somehow do something like that in addition to the current opinion related to the spreadsheet that we have. So that is what we talked about in that group. Is there anything that folks want to follow up on? Let's see. One thought for framing the communication may also consider that some parents don't want too structure. Don't want too much structure and curriculum throughout the day and would seek a more play-based learning, that there may be a stigma that licensed or licensed exempt means that you're stuck to a curriculum and you don't have freedom to design your own program. Yeah, that could be a good topic for communication. So are there any questions about any of the things I just raised on standard operating procedures?
Or
Any
just
thoughts?
yeah, very quickly. I'd be curious, and we're happy to help with this, whether there are any, I don't know, cross-state comparisons around best practices of closing down care or issuing cease and desist when care should be licensed. For example, is there a best practice in turnaround time for getting a letter or a fine issued? Is there Mary Alice, when you were describing the procedure, how long does surveillance have to occur? Is there an opportunity to think about immediate notification and then surveillance? Like if we're immediately concerned, if the evidence is so strong, can we skip over the surveillance step? I don't know. I'm just wondering if, there's anything we can learn. And I realize so much of this is a resource constrained world when we think about dollars for enforcement for these things and the time it takes. But again, happy to be a partner and think through that. But I was just wondering if there's any sort of best practices in this area of enforcement that we could learn from.
Yeah, thank you, Bill. And yes, Laura has conducted research on other states. And so as a next step that Laura will be sharing, we're going to dig into specific recommendations that we can really start moving forward and we'll bring to those groups this information. And I'm so grateful that Senator Young is here with us and helping us through this process. Because I think having your perspective on what is feasible for legislation, what is not. I want to also share that there is very strong will for the Department of Human Service to move this forward as whatever we have to do for budget requests or anything else. I also wanted to share that with the money that we have coming through with our American Rescue Plan and some of the systems work, there could be alignment that we can utilize the funding in that the discretionary funding that we just received guidance on. How can we utilize some of that funding as well as other funding that would be required to lift up a unit to do this investigative work? I can share that some of the recommendations that came out of this, Laura, that there's some that I think might violate one's constitutional rights, like a sign or something like that. But there are others that we absolutely can dig into to formulate a good plan for.
I think so too, and I think it's great to have that kind of open brainstorming where we're worried less about why we can't do something and just sort of getting it all out there, right? And I really appreciate folks' willingness to think outside the box and share ideas, even if ultimately they might not be something that is feasible. So I think that's great. Okay. What about adding a discussion around a provider watch program, like on the lines of a neighborhood watch program, share information? Yeah, I think, thinking about what to do with the information you have, educating folks about what information is useful, and then spending some time educating people about what to do with the information that they have is great. It is great. So thank you for that. Okay, so let's go into the next work group. First responders. This one was so interesting. You guys are just cool. So this work group discussed tools for first responders, and we used as an example, EMS or ambulance folks, emergency medical services, police and fire. And we tried to identify the kind of information that could be shared with these folks, and how it's best communicated. So I learned a lot in this one. So first responders, we learned that first responders are generally comfortable with assisting in sort of elder abuse and child abuse cases, CARES kinds of cases. And so we would just be adding on to sort of an existing body of knowledge. There was a question about whether we could have an email address that collects data from first responders. We understand that there's, a portal in CARS into which, information about a visit. I'm going to use all the wrong language, just like an idiot. So just pretend like I'm saying the right words as far as describing these things. So there's a portal into which people put information, which then goes back to dispatch. And then that information is collected and processed. Someone asked the question, is there a way to automate this so that automatically that information goes from that portal or that system to CDHS or to other places? And the general consensus was that that would be very difficult because different departments use different operating software. So the fastest way would probably be to create some sort of form or identify a few details that could make the form easy to fill out and then email it out, right? So sort of piggyback on something that first responders are already doing to get that information more completely to all the parties who are involved. Some of the areas of information where first responders might like additional detail is how to read a license. So how to identify how many, what does it mean when it says X kids from Y age to this, show them this is what a license looks like. There's a sticker and this is the year. I think we have a concern there that sometimes providers don't receive a sticker in a timely way, and that could create confusion for first responders at the no fault of the provider. And what we don't want to do is create a situation where things are sort of unnecessarily over investigated, right? So that people feel harassed. We thought about identifying some red flags to look for. For example, the exempt care limits of more than 2 children or more than 2 babies, things like that. Kind of a summary of exceptions and relevant law. If we can come up with a graphic or a small card that could provide a little bit of that. And then sort of big picture, there was some questions about how can we avoid unnecessary scrutiny on permitted care, right? We don't want to create, fear or confusion in the population that's providing care. And so how can we do this in a way that is sensitive to the important work that is identifying unsafe care? And then on the flip side, the important work of allowing providers who are absolutely operating within the law to continue to do so without feeling like they're being, unnecessarily surveilled. There was some conversation about how the information should be conveyed. We talked about, a flyer or a sheet or a piece of paper, and then also some training. The general consensus was that trainings are best done online. And if we can create a training and send out to different folks, might be useful. For example, for fire and EMTs, one thing we learned is that like Metro and South Metro, some of those larger fire districts are a good place to start, both because they cover a lot of area, but also because they provide a lot of the training for the smaller houses. So if we form additional work groups on this, any of that kind of real, boots on the ground knowledge of how these things actually work could be very useful, so that we're not, expending unnecessary resources or providing resources that folks don't want or need. That said, the smaller volunteer departments shouldn't be forgotten, so we should make sure that we're blasting everybody. Fire is generally considered an avenue to the EMT because most fire folks are also EMTs. There are a few small private EMT providers, such as AMR, and we could reach out to them as well. One great suggestion I think that came out of this task or this work group was, are there some instances in which we could have co-responders? I understand that in Arvada, if there's a call that is likely to need some sort of mental health, that there could be a social worker on site, or you could co-respond to 2 different sort of practice areas. That is occasionally done, in my understanding, already in the department. If folks are going to serve a cease and desist or something, and they'd like a police escort, they can do that. So participants expressed, this was offered as a response to sort of a concern about chaos or fear in the community if there's increased enforcement, particularly with folks who've had bad experiences with mandated services, right? So folks, communities in crisis or people of color, just folks who are involved in that sort of mandated service area. And with the idea being that if we decrease adult stress, then we'll decrease the stress in children as well. So I think that's a great idea. Supervisors may need to understand with connection and going into the what is the content of the training. Supervisors might need to understand a bit of the why behind enforcement, but the sense was generally line personnel probably didn't need a lot of that. They just needed to know what to do. We were encouraged as a task force not to worry about the increased burden on first responders, which is difficult to do because they're there to help and they can, apparently they can take this on. We can obviously try and be as efficient as possible. Childcare, another interesting thing we thought of was the childcare rules require providers to report when they have had contact with emergency personnel. That's in 770152. So when they report, could we include in that regulation that they should provide the incident number or the case report number from that contact? That way, if we ever need to connect the two, it's easier for the department to call the police and say, hi, it's case number blah, or incident report or an incident number blah. So that would be one step maybe in making that interdepartment between departments communication easier. Emergency personnel liked the idea of sort of an exempt provider database or something like that. And so perhaps we could look at Colorado Shines and say, these are current licensed providers, at least have that. So if you have a call to a particular area, you could run an address through a database and find out if there's at least a licensed provider, even if we're not yet able to include exempt providers in that kind of a database. So that's what we have from that. Any comments from anyone who was in that group? Adam, did I use just embarrassing words? Are you just embarrassed?
Oh, no, it was fine. It was
Close
fine.
enough.
Yeah.
Good. It was a very robust discussion and I appreciated what everyone brought to that table. Are there any comments from folks who participated in that task force or that work group or who didn't, who want to talk about the role of law enforcement and other first responders in the role of encouraging safe care?
I just wanted to share, Laura, that I just really appreciated that that strength-based approach of imagining from a provider's perspective what it's like to have people at their door and that feeling of just not being safe. And so that idea of having that co-responder to really support that the provider, I just love that. So thank you. I loved a number of these recommendations. And Adam, I'm so grateful for you being at the table, bringing your insight.
Absolutely. And I apologize for being late. We actually have a kiddo with a broken arm at a daycare facility. I called right before this started. So that's why I'm late.
And I can't take credit for any of these suggestions. These come from the smart providers. I think it was one of the Katie's maybe who came up with that one for the co-responding. All right, so let's move on to statutes and rules. Okay, so we talked about statutes and rules. This was our, how many have we done? Third or fourth? So the statute and rules work group talked about what changes we might make, sort of thinking long-term, to statutes and rules that could support safe care. So some were very specific and some were more general. There was significant overlap in this group with the law enforcement group. And we had a number of questions and requests for clarification about fines and how fines are issued, when they can be issued, who issues them. And so there were questions, can we change the statute so that fines can be issued directly by the department so we don't have to wait to go in front of an administrative law judge? Then there were some questions about how the existing or how the previous statute before Ellie's law compares to the statute after Ellie's law, and whether that changes either the mechanism or the purpose of fines. And those are things that may have to be investigated and sort of report back. The fines issue was important to some of the participants because they believed that money is a significant motivator for providers who are providing care that should be licensed but is not. So that's why they felt like if providers who should have a license because of the nature of the care they're providing are fined, that might, sort of encourage them to come into compliance. We had very disparate recommendations with respect to ratios. Some felt like they should be increased to allow more children to enjoy licensed care, and some felt they should be decreased because they viewed that as a safety measure. So it's just a great example of how, great minds can describe the same apple in a different way, different ways to view the same thing. With respect to going back to statutes specifically, providing care in violation of Title I is a misdemeanor. So there was a request for some additional information about how we can get this fact out and enforce it, and sort of what can we do with this, because there are two different sections of the statutes that discuss fines, and one also talks about this kind of care being a misdemeanor. So maybe we can either tighten up those statutes or understand a little bit more about why they're perfect the way they're written, and we just need to get the word out. There were some questions about what local towns and cities are doing with respect to this issue. Denver uses the licensing code as part of the municipal code. And I know there's some other towns that have regulations. So is there some interaction that we should be having with with cities and towns and local governments? There was a question about why cease and desist information online is different from information posted about injunctions or care that was terminated, wondering why one of those sets had addresses and one did not. And my understanding is because the ones with addresses, it's completed, there's been a decision, as opposed to cease and desist, which is still open, but I don't know. So that might be something we could flesh out a bit. Some participants asked for additional data. So one opportunity would be we could have a focus group to discuss what kinds of additional data would folks want to see, just to sort of level set where we are. Some folks were interested in a waiver program so that providers can increase their capacity for a time if they're in a crisis of not having enough infant care. That goes back to the ratio issue we talked about before. Again, specifically with respect to fines, there was a question about whether we could tie the fines to the number of children in care. So right now, the statute that talks about fines talks about it in terms of a fine per day of $100 up to $10,000 for providing care that is outside of the statute or an exemption. The question was, can we also tie that to the number of children as well? So perhaps it's $100 a day for this bracket of children and X number of dollars for this. So the more kiddos. There's some precedent, I believe, in some other states for something like that. Specifically with respect to chapter 26, and maybe I should just email this out, for 26.6.103.1 little I 1.5, there's not an enforcement action tied to that statute. So folks were wondering about that. Then the fine sections, and then 26.6, I think it's still 103.5. Says the department shall provide education. Are we doing enough there? Are we doing enough to provide education about safe care? And is there something else we can do? And so that's it. We again talked about the idea of having CDHS issue the fine directly and then having an appeal process. So we talked about that again as well. What questions do we have about that section? And what did I miss? Oh, there we go, Mark. So someone just asked about the fines. Mark, is that the fines after Ellie's Law, or is that from a different place? That's after Ellie's Law? Okay, so the statute we were looking at on Monday must not have been updated yet on Lexis. That's at $100 per day. And then this one says $250 a day for the first day, $500 for the second day, and $1,000 for the third and subsequent days. So significantly higher fines as a result of Ellie's bill. So that's great. Thanks. Sorry, I had an old version of the statute. Any questions about that, about places where we might tweak regulations or statutes, or about what that process looks like? All righty. Okay, then let's go on. We have two more groups. So then from 4:30 to 5:30, we had a fatality review process discussion. And I think there's more work to be done with this group. This group talked in a discussion about the fatality review process and communication issues in the event of a tragedy, being abuse or neglect or a fatality. The overarching theme for this work group was a general lack of communication between local agencies in the state, and then between different agencies at the state level and local agencies at the local level. So just lack of communication. Some participants reported that licensing learns last about what if there's a fatality or a near fatal incident. The county, some people felt like the counties don't communicate, or at least that some counties don't always communicate with licensing, and it's sort of on a case-by-case basis. Some folks felt like there was a real delay in information transfer if it's not deemed an emergency. Folks thought that everyone should get DHS involved on the spot immediately. And to Bill's points earlier about hospitals, this was one area where communication with hospitals and with medical professionals came up. There was a general belief that hospitals do not communicate consistently. And in talking about that, we talked about the sort of the different reasons that you can have infant deaths. You know, if it's a medically explainable death or it was not unexpected, you know, you've got that category versus an unexpected death. So we talked about maybe just fleshing that out a bit more and seeing what we could do to support hospitals and communicating that information out as quickly as possible. Someone made the observation that school districts are amazing and they report everything. So how can we get everyone to be like school districts? The Child Fatality Review Team and Child Fatality Prevention System, if I have those acronyms correct, issue their reports on what their findings are in July of 2021. So I think we can hopefully share those reports with the task force when they come out. And those are retrospective, so they're dealing with incidents, I believe, in 2020. But we might be able to glean some, look at their legislative recommendations and glean some patterns. Again, we talked about ratios, should they be increased or decreased? And we talked about how we can get ahead of this and make information more available to the extent that it's not. Making sure children are safe is a community responsibility, and it's not the fault of one, you know, person or parent or provider. It's usually, so we have to focus on this from a community prevention lens, folks thought. People ask the question, how can we talk about education that in a way that's not patronizing or insulting to individuals? We use the term awareness, sort of tossed around some languages there. And then we talked about the difference between the way that the system treats a bad injury with a long-term impact, where there maybe wasn't a significant negative intent, versus a minor injury where there was a significantly harmful intent. And those things together, the thought was understanding the distinction between those two categories of fact patterns, if we can be reductive, might explain some of the inconsistent responses to those, right? And so the important thing being, if it's a mild injury, but it was the result of a significantly negative intent, that needs to be brought to the attention of the larger group in the same way that a severe injury without that intent may need to be brought to the group, if that makes sense. Someone asked if we could use the CDC SUIDIRF, SUIDIRF, Sudden Unexplained Infant Death Investigation Report Form from the CDC's as a starting point for some of this information collecting. It's interesting, this form, I understand, is very detailed and asks a ton of questions, which could be very useful. A form like that in sort of that every time law enforcement encounters something could be too burdensome. So we may have to have an abbreviated form with, 4 or 5 questions there, like what was the address? What's your general concern? What happened? Blah. Maybe there are times for reporting very short lists of information and then times to get into more details. Could be an interesting discussion to figure out when those different points in the system or in the line of communication happen. One thing we thought about maybe is creating some sort of editable or customizable standard response protocol for folks who may need to report that we could push out then to local governments and counties and other folks, just to have sort of a best practices place to start. So even if different communities receive different kinds of information or have different patterns, at least they'd have somewhere to start in creating a standard response protocol. I thought about that. And then someone asked, and I don't have a lot of information about this, but how can we use the system that's in place right now for death notifications? Because apparently there's a system that's already in place and streamlined. So I don't know if anyone can provide additional details on that. So for that task force, I think there's a lot more work we can do. What are some thoughts? Oh, here we go. Thanks, Katie. Here's the report for the child fatality prevention system that was just made public today.
Yeah,
What
I think
about that?
that's great. And then Mark Meckert, I'm just thinking about, and Joe and Kate, like there's so many of us that we look at what happens down the road. So how can we meet immediately to dig in and learn what happened and what we could do differently? And Mark, I think you had some ideas on that too from earlier conversations. If you want to share, Kate, if you wanted to share what your committees are currently doing in this area.
Yeah, I think part of the struggle in terms of when we meet is, having enough time to gather relevant information, to look at it, to try to really step back and take a bit of a systemic approach and looking at what led to certain decisions. So whether that's from a provider perspective or from the family perspective of utilizing those services versus licensed care or different options that may be available to them. So I think some of the, if there is a faster group that comes together, part of that might really be to help identify what are those areas where we would like to have more information that helps us understand what went into those decisions at the moment, right? Because I think I know for our system, the Child Fatality Review Team system, we are trying to take more of that systems level model and thinking to identify at a socio-ecological level, right, within community, within organizations, what are those factors that are driving people to use this type of care, to provide this type of care. I love the discussion that's taken place so far and all the education aspect. I think that's really a critical component to it. But also the availability of different options within certain communities. So how do we even gather some of that data to have that perspective of what options are available to people, and how do we make sure that all of the collaterals that we've talked about are aware of those, so that when families are in front of them, we can help them make more complete, informed decisions. So I'm trying to be careful with that language, right? But really, like, how do you make the most informed decisions possible?
Great, Mark. Thank you.
I totally appreciate what Mark's saying, and I do think it's important we think about learning as much as we can about what's happening in that particular situation or that particular home, as well as thinking about publicly what we need to communicate. But I do want to point out a third piece, which I do think CFRT does, that we don't do, is a little bit also of the after action review on our standard operating procedures, right? As we change and lift those new SOPs, are we following them? Are we learning things about what's working or what's not? And allowing that to continue to modify our practice. So I do also think a little bit of the looking at our own systems and actions and how they're working is an important part of that review process.
Kendra, is that the kind of review process that would happen sort of in the moment or sort of over time after more information is gathered?
I think it's probably after time, but I think you have to have a process to do it. And I think it is separate of what is happening with the child fatality prevention system review. So I'm just kind of calling out that like with child maltreatment fatalities, we do have that kind of dual lens of being able to look at both sides. With fatalities that happen in childcare, we do not.
Okay, thank you. That's great.
Kate, were you going to jump in there?
Yeah, I just quickly, I think Mark and Kendra both have really good points, and Mark said it really well too, right? That we don't want to wait until there's a specific case where this happens. We really want to think about what our system of childcare looks like in Colorado, acknowledging all the different barriers that families experience. And then I think to Kendra's point, you know, the child fatality prevention system at the state health department does have the ability to do a review like that, right? So we review all deaths of children that happen in Colorado, regardless of if they have contact with child welfare. And so a local team through that process may identify that there was a missed opportunity like this, or that there was something about how the system through licensing or whatever it is could be improved. But I also hear the need in what Kendra is saying for a really specific detailed dive into that, because I think sometimes that's obviously maybe on my scope. And so there are lots of details that we need folks like Karen and others involved in on that conversation too. And I do think that the retrospective review allows us to really have all the best information. You know, we wait in our system until the death certificate is fully closed out, because that way we really understand what coroners, what law enforcement are telling us happened to this child. And that takes time. You know, that system doesn't close until this time of the following calendar year. And we're just closing out our death year for 2020 at the state. But I also do really acknowledge and hear the need for more immediate action to be taken, because it can feel very, very delayed when we're losing young people.
Maybe one other quick thought. This is not an area of expertise or knowledge for me, but there have been 2 bills over the course of the past 3 years that have really overhauled our maternal mortality review committee, and really, I think, have tried to beef up the resources that can go to support that, the ability to bring the voices of those who are impacted into that work. And I just wonder if, you know, the teams that do the fatality reviews, including on the child maltreatment and, you know, on the childcare side, had, you know, the ability to step back and think about, you know, do you have everything you need to be able to do your work well, whether it's a resource constraint, membership participation. I know one of the things that was important in the maternal mortality review, I think they put in something around subpoena protection so that participants in that committee could review details without having to worry about being called to testify in a civil case, for example. You know, things like that. I wonder if there's anything in that maternal mortality review statute or lessons learned or ideal requests, just to make sure that whether it be the quick response or the systemic response, you know, the teams that are doing this review have everything they need to think holistically. And then the corollary to that is, you know, we read and you know, the child fatality review report every year. And you know, the recommendations consistently, especially in recent years, have lifted up the importance of safe, affordable, available childcare, and I really appreciate that. And worry at times, you know, do we need more teeth for that? Is there something that can bring those recommendations to life, as opposed to things that, you know, live in the advocacy community or live in state agency strategic plans that require some policymaker contemplation of those recommendations?
So I appreciate that question. I think that I would say for the child fatality review team, we have like those discussions that multidisciplinary team has. Their statute already makes them privileged. So there is sort of that safe environment, if you will, to have the really in-depth good discussions. You know, you mentioned the after the recommendation aspect, and I think I don't know if teeth is the right answer necessarily, but I think we have been working to try and get that cross-system collaboration. And that really, I think, is the key and the remaining piece for all of us. And I think even in this work is going to be critical, because truly most of the things that we see when we make recommendations and are looking at prevention, they're not any one individual agency's sole responsibility or within their unique purview to impact, if that makes sense, right? I think the recommendations that you just pointed out that we've been making jointly with the CDPHE process, the Division of Child Welfare, we have somewhat limited ability to impact the creation of additional affordable, high quality childcare options for families, right? And so how do we get others to recognize their role in the system, right? Everybody is responsible for preventing these. That's all of us. And the question is, what is our role? What's in our sphere of influence, and how do we get everybody together? So I don't know if it's a teeth perspective so much as a joint ownership and collaboration perspective, and how do we do that? And I think like these calls, these meetings are a great beginning to that, but how do we keep it going afterwards, right? So I think that there is really, to me, the key question, and where we need to keep getting that, just the involvement and joint ownership of the solutions.
I'll just quickly echo Mark's sentiment. You know, we are really fortunate in Colorado with our child death review processes to have state funding allocated. We do have subpoena power. And, you know, when I talk to colleagues in other states who do this work, some of them do it for no money. And so I'm so grateful every year that Colorado invests in this process. But what we hear from our partners, and I was quickly scanning the attendee list, I'm not sure if I have any local partners who participate in the child fatality prevention system on today, but what we hear all the time is we have funding to do these reviews, and we can tell you what we know about children who are dying, and there's no money to do anything about it in the same way, either at the local level or the state level. And so I appreciate that call out that we can definitely be doing more to make sure that families have the choice for childcare that they want. And if I missed anybody who participates in the child fatality prevention system and you want to share your perspective, I would really love to hear it.
That's great. And I think what you all are bringing up about sustaining this discussion and this dialogue it will come up in our recommendations here shortly. I just want to spend a couple minutes on the final sort of general town hall that we did, and then I'll list for you sort of and get your initial feedback on our sort of first round of investigations. We had a final session from 6 to 7 at night, and it went a little later, but to allow folks who have jobs during the day that prevented them or had conflicts during the day that didn't allow them to attend the other sessions. It was sort of a free for all in that folks could talk about any particular topic. There was some general discussion about how do we define safe care? What does that mean? Because we're having so much conversation about what is unsafe care. And then in 26.6.103, go to the statutes, there were some questions about occasional care. Is that there's a definition of 3 hours or less in a 24 period. What about care for a less period? And then in looking at the definition of no discernible pattern, that earlier provision, is there an opportunity for us to tighten up or explain or define some of those terms so that it's very clear about what is exempt and what is not? For example, the Department of Defense contracts, someone shared, talk about 10 hours or less per week and no more than 2 hours of time at a time. And that would go into, so just other language. Is there anywhere for us to sort of polish those things up? Additional conversations about ratios, about how a license goes to a property and an individual, general questions about how we can speed up the process of injunctions, a question about whether we can have an alternative set of sanctions, like, the example that was used was either you go to rehab or you go to prison. So is there some way for us to further incentivize providers to come into compliance with the law, or else there are additional sanctions? And that was it. So that was sort of the high level summary of, I just lost Zoom, here you are, high level summary of what happened in those meetings. So if no one has any additional comments on that, and I will open up the floor to make sure, then I'll go into some of the recommendations. Any comments before we get there? All right. So the first set of recommendations or proposed recommendations there were 3. Number 1, that a separate unit work on enforcement, so it's separate from licensing specialists who deal with compliance, with the idea that, you know, sometimes folks who are working on or who are licensing specialists are focusing so much on licensed care. We want to make sure we have someone who's focused on all the different areas of care, and so that they have the bandwidth to make sure they're working on enforcement. That was one. Number two was a request for a graphic that specifically talks about all the different categories of care, to make sure folks have that. Number three, the original recommendation was some sort of graphic or something that could be used for law enforcement, just to help them understand what, you know, if they're on a call and they run across some sort of unsafe care, how can they make sure they're connecting the dots? That was sort of expanded to include some additional training and, you know, and then some reporting procedures, because one of the recommendations is that we try and dig a little bit deeper into communication between departments at the state level, between the state and the local level, and just make sure, exactly to the point that I can't remember who made it, Mark, I think, to make sure that we're continuing to communicate and continuing that dialogue of holding the entire community accountable and making sure that folks have information. And that includes the process of identifying a piece of information as relevant and then making sure it's getting to where it needs. So we'll have some sort of additional digging into that. We have a recommendation to consider the viability of co-responders in certain circumstances where law enforcement or someone is going out to also have someone potentially from a new unit that's talking about enforcement of licensing regs, so that it's accessible to the community and hopefully, you know, it makes that information that's heard in a way that it can be absorbed, if that makes sense. If we're going to conduct a media campaign with the earlier referenced graphic, that we do that in a way that encompasses a number of those resources that we identified in the very first work group, being social media, and that there are digital resources that we could download or people could send out for partners who have the funds to print things out on their own and who need to distribute information in that way. And then making sure that that information is readable on a phone for folks and is in other languages so that folks have access to it. We're going to ask the recommendation that we're going to ask for some sort of opinion from the AG or to investigate the viability of using a model like is used elsewhere, where the department itself can issue fines, to accelerate that so that fines can be issued earlier in the process and not after a full AG hearing. And then with appeal rights, so folks who are wrongfully, they believe, assessed fines can appeal that, but to just sort of bring that to front, to sort of compress that timeline between identification, you know, confirmation and action. We're going to dig in a little bit to the fact that we have a misdemeanor and fines in general and how that works, and then looking at how that's treated on a national level to make sure we're using best practices if we can learn from other states. We're recommending that there's some sort of a process when someone learns of an incident where there's an immediate response, where there's just a phone conversation, where you have that first communication to make sure that all agencies who need information about a tragedy or about an incident are on the same page, and so that a communications plan can be developed so that information is getting where it needs to. And then that, to me, is sort of the immediate need. And then afterwards, you could also, I think we could add, you know, something along the lines of what Kendra was talking about, building in then, you know, some sort of process where additional processes are considered. You know, what did we learn from this? But to me, it's sort of two different buckets, right? There's the, what are we going to do about this tragedy that happened today? And then let's address that. And then let's make sure this other thing is still on our to-do list so that we don't miss an opportunity to improve, to, you know, make this process more efficient. What else? I think that was it. Did I miss anyone who I've talked to about any of these?
I don't think you did, Laura. I think that was thorough from at least what I reviewed. And what I wanted to share that I shared, I think, on our first call, is that some of these recommendations will require rule change. Some of them will require legislation. Some of them will won't require anything except money for our comms team to get all of this put together and out. But I am just so impressed by the recommendations and the power of this group and what we've done so far in such a short amount of time. And now what Laura will share is our next steps of now how do we start building out these recommendations, the next step. So it's just really just very powerful. I'm grateful for all of you and to be part of this.
So the goal is that in our next meeting, so we will not have work group meetings this next because of the holiday and just because everyone's been working really hard. So we'll take a pause. We'll meet again in 2 weeks. And during that, by then we will have articulated in more clear fashion than I just did what the recommendations are. And we'll identify, 3 or 4 that we're going to dig into in work groups during the hour. And that way we can continue to sort of drill down. Some of these things are complete, are complete as is. We're going to do something now, it's off to the comms team, or we're going to ask the smart lawyers to do what smart lawyers do and investigate whether there are statutory changes. But other things will require additional thought, like how do we continue to create that accountability for everyone when we're dealing with issues like this, and communication. And so those are areas where we'll look to you all to bring your smarts to the table. And so we'll do that in our next meeting in 2 weeks. And then we're making rolling recommendations. So some of the recommendations will be sort of more, we're going to look into this, or we recommend you look into this, and then others will be more specific. Yes, Joe.
Yeah, thank you. And I really appreciate the rundown. That's wonderful. And I love the ideas, the recommendations, and I look forward to digging in more, not only in terms of have we thought about everything, but also in terms of capacity and resources and funding. And we might have to have more conversations if there's a ceiling of funding, or if there's a ceiling of time, some other kind of, left and right limit that we don't know about as we talk about value add. I look forward to that as well. I'm wondering about FTE, wondering about public campaigns and any number of things. Again, not to minimize, but just so that we're all, not to minimize the strong importance of each of these, but to make sure we're keeping tabs as to the resources required so that we can share that information as well as stakeholders.
I appreciate that insight, Joe, and that I think that makes sense. It doesn't make sense to draft a beautiful, perfect, glossy brochure and then stop there. Don't want to spend all our money on shiny things. I agree. That makes perfect sense. All right. What other questions do folks have as we spend our last few minutes of wrap up and then get ready for our next? Anyone who wants to listen to the work group meetings, the sausage being made that happened on the 28th, they will eventually be on the website at some point. So you'll be able to go back and do that. Any other final wrap-ups? If not, I will just thank you all for all of the time that you spent on Monday. It was truly Herculean, and I am dazzled by your ability to remain engaged despite repeated and long meetings. So thank you all, and I hope you have a great 4th of July. Eat some popsicles.
Thanks, everyone.
Everyone.
Thank you.
Bye.
Bye.
Take care.